5:40 only on Sunrise this morning. NBC5 News is continuing our partnership with Prostate to bring you better health.
This morning, we're sitting down with Prostate health expert Beth Coker and urologist Dr. Luce to discuss prostate cancer. Today, we're talking about an important men's health issue. We're talking about prostate cancer.
And Dr. Luz, we know that prostate cancer is the second most common cancer among men, yet it is highly curable if it is contained in the prostate gland. When should men be screened for prostate cancer?
There's a lot of factors associated with when to start screening. Mostly, prostate cancer is rarely found in men under 40 years old, so we don't recommend any screening for men under 40. The AUA, which is the American Urologic Association, would recommend starting at around age 55 in a normal risk patient, and as early as about 40 years old in people who are at higher risk due to family tendencies or ethnicity.
What are the types of screening that you would do for prostate cancer?
Right, so the main screening that people get done, and what I was referring to is the PSA screening, which is a blood test that stands for prostate-specific antigen. And that is a chemical that's produced only by the prostate, so women have a 0 PSA, and men with a prostate will have a variable number. We don't want to typically set a specific number that's normal or abnormal, so men need to be screened kind of year by year to sort of see look for any trends in the number.
So are there risk factors involved in prostate cancer?
There are. Obviously, only men can get prostate cancer, so it's that. And then there's age. Like I said before, it's pretty rare in the younger men, and it becomes quite common in older men. Ethnicity is a factor. Men of African descent have a much higher rate of developing prostate cancer, and also have a higher rate of developing more aggressive types of cancer.
So once you've determined they have prostate cancer, what are the treatments available out there?
There are many treatments, but the big three treatments are, number one would be surveillance, which is kind of no treatment. It's just sort of keeping an eye on the things and making sure that it doesn't get out of hand, because it does tend to grow pretty slowly. And actually, that's in most men that's appropriate, even for some younger men, and certainly in the older age group. Surgery is an option, especially for younger men and for men with more aggressive types of cancer. And the other sort of major treatment is radiation therapy. And there's different ways to give that. And there are also some emerging therapies that are probably, not necessarily recommendable at this point, such as cryotherapy or focal therapy with high-intensity focused ultrasound.
So for men, be aware of the risk factors in their lives, and it's very curable prostate cancer if detected early. That would be the message that you put out.
Right. I mean, it's curable if detected early, and also a lot of times it doesn't need to necessarily be cured, because it's a high percentage of prostate cancers are actually so slow growing that it's appropriate to just sort of keep an eye on the cancer and monitor it to be sure that it doesn't ever actually need to be treated, because the treatments do have potential negative effects.
Perfect. Great information. Thank you so much. We'll be right back.